the year has started very strongly. I think last week we announced the signature of the LOI of our largest human challenge trial to date, and now we're announcing with our trading update our first acquisition of the year, or since I've joined.
Hello, you're watching Proactive. I'm joined by hVIVO Chief Executive Mo Khan. Mo, a lot of very positive and exciting news out this morning. Let's start with your full year 2024 trading update. Could you give us a quick overview of what sounds to be a record year for the company?
Yes. Oh, thank you for having me on. Yeah, it's been an absolutely amazing year for the company across so many fronts. So if you just focus on the numbers for the time being, so we've achieved, well, we hope to achieve 63 million pounds in revenue. That's at almost a 12% increase from 2023. Also, we're going to hit a whopping 26% in EBITDA margins, which is a record for the company. And I also think it's probably industry leading in the margin sense. And then on top of that, we've amassed a cash pile of around 44 million pounds at the end of last year. So from a financial point of view, we achieved and in fact beaten most of our parameters. But this has also been a very significant year for the company from an operational point of view, because not only have we done so well across the financial numbers, but we also moved to the world's largest human challenge trial facility here in Canary Wharf, East London. So that's been a huge effort by the team to deliver so much so fast. We've delivered record numbers on inoculating number of patients. We've launched new service lines. We've recruited over 800 patients in a field trial in 6 weeks. We completed the world's first flu B challenge trial. We developed some new challenge agents. And all in all, if you look at what we delivered from operational and financial point of view, I can only say very, very high things about the team and thank them for their commitment, and they deserve all the credit for this year.
Now, some more big news is the acquisition of 2 clinical research units from CRS. Tell us more about that.
Yeah, so that's a second exciting news. So the year has started very strongly. I think last week we announced the signature of the LOI of our largest human challenge trial to date, and now we're announcing with our trading update our first acquisition of the year, or since I've joined. And I think this is crucial for the company. So we are looking to acquire a couple of units from a CRO in Germany called CRS, and this is for around 10 million euros, and it's funded completely by our own cash resources. The 2 units achieved a revenue of around 20 million euros in 2024, making a loss of just under 2 million euros. The first unit is based in Mannheim with around 96 beds. The second unit is based in Kiel with around 26 beds. So overall, around 120 beds across the 2 units. And I will say we will make acquisitions that enhance our service offerings. And I believe this asset is a really good for us as a company, and it takes us to the next level in early stage clinical development services.
Well, great to see you delivering on your M&A strategy. Why did you choose CRS?
Well, a number of reasons. We've reviewed over the last couple of years, since we've been actively looking for targeted assets, we've rejected a large number of assets for a variety of reasons. And this one we felt is the best fit for us. And the company itself has a very strong history. I mean, they've been going since 1977, have run over 2,000 phase 1, phase 2 trials. So they have a long history in doing this type of work. They have a reputation for quality. Even last year, they were inspected by the FDA, a routine inspection, and they had no findings. And they're considered to be one of the leading companies delivering on early stage clinical development services. So from our point of view, it seems a very, very good fit. They have a strong, loyal customer base, including large pharma with more than 50% repeat business. They offer services that we don't currently offer, which is great for us because it adds diversification. And they also outsource services that we currently offer. So we think by combining the 2 groups, we'll be able to offer more services, which is better for us because it increases our overall revenues, but also good for the clients because it provides more service, a better service in-house. And of course, the fact that we're paying around 50% of the revenue of the company also helps the case. And when I looked at this company, I felt it's not too much unlike where hVIVO was when I first joined. It's great people, great science, great facilities, but just needing direction and focus. And we think here that we can do a similar turnaround at CRS too.
Could you take us through the synergies, Mo?
Well, there are many synergies. So they do a lot of phase 1 trials, which we don't offer, but also do a lot of phase 2 and phase 3 patient trials. And that basically means that combining all the forces together, we can offer up to 5 clinical sites, encompassing around 200 beds across the new entity. And when it comes to patient recruitment, of course, it's a huge addition. The fact that we've added a completely new country to our portfolio, and we've got a database which is even bigger than what we had here in the UK. And at the end of the day, we should be able to offer end-to-end clinical trial services. And this also really boosts the potential for Venn Life Sciences and their consulting service lines, because most clients who work with CRS, of course, they're working in either preclinical or early clinical. They require consulting services, and Venn and CRS would combine together and provide a much fuller end-to-end service. And then, of course, once the phase 1 is complete, for phase 2, hVIVO and also CRS can come together to provide a bigger service. In addition, a majority of, I think over 99% actually, of their clients, CRS's clients, are European-based, where ours are US-based. So there's another synergy there. So across the board, they will be from all the back-end services as well as sales and marketing. So we think we selected a good target assets. And I think, especially in 2026, we expect big things from the new group.
I mean, it looks like you've certainly laid the foundations for future growth with the acquisition, Mo. How is it expected to impact your full year 2025 and beyond?
Yeah, so for full year 2025, we expect to achieve revenues around £73 million. This will still mean it's a good, robust year for the core business. Now, if we remove the 4 million odd we received for the facility fee last year, it is still growth in the challenge trial market for hVIVO. But with addition of CRS, we of course expect to see revenues go up to 73 million euros. With regards to EBITDA margin, we expect to see a small dip in the margin for this year, because we will be integrating and investing in CRS to bring them to where we want them to be. So we're looking to achieve EBITDA margins into the mid to high teens, but still remain cash generative. And as we move into 2026, we expect higher growth in revenue, but also we expect CRS to be earnings accretive as we begin the turnaround for what they offer. So the group expects to deliver very good numbers in 2025 and even better in 2026.
How about the order book for the combined group?
So, as you know, we report the weighted order book, and that currently stands at, well, at the end of last year, it currently stood at around £67 million. So it's a good, healthy start to the year. And this does not include, by the way, the recently announced large whooping cough challenge trial that we have signed the letter of intent for. So we are starting in a very good position at the beginning of the year 2025.
In September, you noted a £40 million pipeline of near-term opportunities. How does that look now, Mo?
Yeah, so I'm pleased to say, well, around 15 million of those opportunities have already been signed. So they form part of our order book, and the rest are still active, and we still hope to sign them in the coming months. So we know in the industry there has been some delays in signatures. That happens across the board with regards to clinical research, but we haven't lost a single of those hot opportunities that I announced last September, I think. So we still plan to finish signature of the 40 million I announced then. But just so you know, we also added some new opportunities since then that we're also currently working on.
Well, congratulations again on the acquisition, Mo. Any more to come?
Absolutely. So this is our start of the M&A strategy. We look to add more assets. It all depends on the type of asset and what services they offer. It has to be complementary to what we do. Our goal has been, to be honest, to optimize and to scale and then to diversify, and we're well on our way in achieving those. And our midterm goal of achieving £100 million in revenue by 2028 remains on track.
I hope you'll keep us updated on any progress. Thank you very much for speaking with us today, Mo.
Thank you very much for having me on. Appreciate it.
That's hVivo Chief Executive Mo Khan.